Well, I think the first thing is not to panic.
That's one thing the North Dakota Department of Health and Human Services wants to make clear. Although no amount of measles is necessarily good,
Death occurs in about 1 to 2 cases per 1,000 cases. And so it is rare, but it is still possible.
the situation in the state is nowhere near a crisis level.
The majority of North Dakotans are vaccinated against the measles.
Still, it feels worth monitoring as one case in Williams County seems to have gone nowhere, but Pembina is a different story, with that number rising from 1 to 6 in the span of just 6 days.
You are contagious 4 days before you even have that rash or are showing signs and symptoms. So a lot of people don't know they have measles and are out in the community, and that's really more when it ends up spreading.
2 of the infected had to be hospitalized.
If you have questions about the MMR vaccine or other vaccines, please contact your healthcare provider or your local public health department, and they'll be able to answer your questions and address any concerns that you might have.
The DHHS has done extensive contact tracing for the cases and has an updated list of possible exposure sites on their website, which does include 2 locations in Cass County. They're asking anyone who might have been exposed to keep an eye on themselves for symptoms, and if you're unvaccinated and have been exposed, to quarantine if at all possible.
Staying home from activities, school, childcare, anywhere in the community, we would want you to stay home.
In Fargo, Gabriel Osler, KVR Local News.